Hello, I'm John Daniels, Chairman and co-founder of Kinaptic. We are developing wearable electronics for the stroke patient's journey. I met my partner Joe Curcio at a robotics and unmanned vehicle conference in 2015. Here you can see Joe controlling me to mirror his hand movement using an early prototype of our haptic human-machine interface. We use this technology to create wearable electronics for stroke rehabilitation using the body's own electrical systems to improve patient outcomes. Our contracture sleeve is put on at the hospital and prevents muscle atrophy. Our pinch and grasp sleeve is put on at home and returns life skills to the patient. Our VR stroke rehab system invokes neuroplasticity, the rewiring of the brain around the damaged area. This patient's hand hasn't moved on its own for 18 months. Our contracture sleeve applies electrical muscle stimulation to stretch his arm with involuntary muscle contractions. This should be the standard of care at every hospital. My co-founder Joe is a graduate from MIT. I'm an innovator and patent attorney and have sold inventions to the largest companies including Microsoft. We expect to hire 10 to 20 full-time employees over the next year. Of course, there's competition. We love competition. Competition shows the enabling technologies being applied for stroke rehabilitation. Only our VR stroke system has our patented wearable electronics that use the body's own electrical systems to invoke neuroplasticity and reconnect the brain with the body. Having this awesome technology platform is critical to our success. It's also important to have barriers to the competition. As a patent attorney and innovator, I've been building Kinaptic's international patent portfolio since 2013. We already have issued patents in the US and expect our first Chinese patent in 6 to 9 months. If you do due diligence on us, you will be pleasantly amazed by the depth and breadth of our international patent portfolio and the many uses of our wearable electronic technologies. For example, in the US, there are nearly 800,000 new stroke patients every year. But because of the cost of a professional physical therapist requiring expensive visits to a PT clinic, most of the time the money runs out long before the patient has reached their rehabilitation potential. China has the biggest increase in stroke patients, with 2 million new stroke patients every year. There are too few doctors, too few physical therapists in China. Our wearable electronic system can be a big part of the answer to China's healthcare crisis. Our patented products improve patient outcomes for other diseases too, like multiple sclerosis, Alzheimer's and Parkinson's, and brain trauma caused by accident. Our solutions fit into existing reimbursement models, and the enabling technology is already FDA approved. Our foundational technology has been applied as a universal wrap for electronic pain relief, with this product being released early next year through an online pharmacy called GoGo Meds. With our strategic partner, Bayer Pharmaceuticals, we will very soon deploy our technology as a wearable electronic for global cardiovascular digital healthcare. With the ability to detect biometric information and digital biomarkers for AI-assisted diagnosis, drug discovery, and remote patient monitoring. We have a technology platform for wearable electronics with a pipeline of products for a range of diseases and for proactive digital healthcare and fitness. We have been in Berlin, Germany for the past year developing our thrombosis prevention product funded by Bayer. We are focused on making this first strategic partnership an unqualified success. Kinaptic receives revenue as the manufacturer of our wearable electronics, with our partners providing worldwide sales and distribution. Bayer is projecting sales of 10 million units per year for this first product, which will be launched in 2020. As we increase our capabilities, build our scalable manufacturing line, and engage with other strategic partners, we will duplicate this model for the additional separately licensed fields of use and also create multiple revenue streams from our own manufactured products. We are looking for an investment of $5 million. We have a rock-solid foundation of intellectual property, know-how, and relationships. We have patent-protected products in an enormous and accessible markets. Nearly all of our equity is still owned by the two founding partners. The Kinaptic team will achieve our goals with a transparent, milestone-gated use of funds plan. So we are flexible to reasonable investment terms that will maximize our enterprise value. Digital technologies have the potential in a very, very short time to change the way healthcare is provided to all people everywhere. I truly believe we are on the cusp of a revolution. My company is committed to contribute to a positive impact on the health and well-being of all people of the world. China and the US are the world's two largest economies, so we must understand that we have a responsibility to find where and when we can cooperate and collaborate to advance digital healthcare. Confucius said, "The grass must bend to the wind." So too, we must bend to this responsibility. I'm very hopeful that my short time here in China is just the beginning of a long-lasting beneficial relationship. Thank you for listening to this presentation. We are hoping to connect with investors and strategic partners here in China. Please come see me or contact me at john.daniels@kinaptic.com. Thank you.